What are the times?
Argue that given we're at 919 or at 800 or 900 cases a day, there's this complacency creeping in that, you know, it doesn't matter how low our case numbers or how high, we don't need to get our case numbers down because we're going to get out when we get to 70 or 80% vaccination anyway. And the system clearly is under so much strain at this level.
My key message to you, and this is why I am just so much appealing to the people of South West Sydney and Western Sydney who have been given priority access to the Pfizer vaccine through a number of channels. Please do not waste this opportunity. This opportunity is for you individually, for your family and loved ones, but it is also for the community. So just to be clear, this is a public health intervention in vaccinating the 16 to 39-year-olds and getting the authorised workers. What we need to see is the vaccine coverage in those cohorts, those groups of people, as high as possible. The modelling suggests that if we can get that group vaccinated, we will break the transmission chain. It will take a while, and that's why when I was questioned yesterday, I said the numbers were going to bounce around and potentially go up. That's what we believe before they come down. But the solution is in our hands, and I urge everyone in those local government areas who have access to that vaccine to fill those appointment vacancies and get a vaccine. If we get those high levels, the modelling shows we will change the R effective and we will see a decline in cases. We have a choice. If we embrace vaccination, we will get there sooner, and that is everyone, but a particular plea to those local government areas.
Based on the current modelling, how long do you think it will take to break that chain, to get that cohort in particular vaccinated as quick as possible? Are we talking weeks? Are we talking months?
What we are talking about is ultimately the model is in the greatest impact is the level of coverage we get in those groups. So the higher we can get, and I'm actually confident that that Australians generally embrace vaccination. And I can't see that we can't achieve incredibly high rates of vaccination. But I want to convey to a sense of opportunity, the opportunity we've given the residents in that area to vaccinate themselves, to protect themselves and their loved ones. But obviously, I'm also reflecting that that is the best thing they can do for their broader community, and the broader New South Wales is by getting a vaccine.
Dr. Chant, we've got one of our largest hospitals, Westmead, you know, having to stop taking COVID patients for 24 hours, possibly longer. Is it time, do we need to start thinking about a COVID specific hospital, a hospital that only deals with COVID, or a field hospital? Have you considered that at all, as was done overseas?
In general, field hospitals are really not what we need in Sydney. Field hospitals are for particular circumstances where you might be in a rural or remote, there might be a train thing and you might have it as a staging post to stabilise people. That's the concept of a field hospital. For COVID patients, and I would defer to Dr. Morgan, we need oxygen. We need copious oxygen supplies. We need a safe environment. We need social distancing. We need beds. We need ability to feed people, care for them, access to drugs, access to IV therapies, access to ICU. So we do have a number of facilities, and as the Minister indicated, we have got the capacity to work with our private hospitals, of which we have significant bed capacity, and our hospitals will be doing a lot of local planning about which patients are best cared for in which circumstance. So just be assured that a lot of that integrated planning across our health system has occurred in preparation for a variety of different scenarios, and those plans are being implemented. So my key message, also echoing Dr. Morgan's comments today, was please do not defer care. Do not think I won't respond if I've got some chest pain. I'm feeling short of breath. I don't want to burden the health system. The health system is there. Call the ambulance, and please do not delay care, because we do not want any see consequences from delayed care.